I'm Tom Hoppy, and I'm your host of the Most Painful Podcast. Military members have all their healthcare needs taken care of while they're in service. But what happens when the members leave the military? How smooth is a transition to the civilian medical system, especially with the shortage of family doctors? And how do veterans navigate the medical system to ensure they get the care they need for their service-related injuries? And what do civilian clinicians need to understand about this transition to better help their veteran patients? To help answer those questions, we are joined by two guests. Brad White, who is a past National Director of the Legion and a veteran himself. Welcome to the show, Brad.
Good afternoon, Tom. How are you?
Good, thank you. And Dr. Abhimanyu Sud, who is the Chief Scientific Officer for the Chronic Pain Center of Excellence and a family doctor himself. Welcome to the show.
Great to be here. Thanks, Tom.
Thank you. For our listening audience, just before we get into the conversation, we have an announcement for a free giveaway at the end of the show, so please stay tuned. So, Brad, I want to start with you. As a veteran and as the former National Director for the Legion, what is the journey for a veteran transitioning from the Canadian Forces medical system out to the civilian medical system? And are there any barriers that they face doing this transition?
I think the transition process after you've spent time in the military, and I grew up in the military, I come from a military family, that's my community. And as you transition out of that community, it's very difficult to shift your focus into a whole different side of the world that is non-military, and then start to make the plans that you need to do to find a doctor, to find a support system. It was actually a shock when I had to stand in line at the OHIP office in downtown Ottawa for basically a full morning, waiting to be served and get an OHIP card. I never had to do that before, so that was a sort of breach into the whole transition process. I was reasonably lucky because we had a community around us in Ottawa where my wife had a good doctor, and that doctor was willing to accept me until she retired. And we went through a succession of doctors, so the consistency of care became an issue, and eventually we ended up with a really good doctor out of the University of Ottawa, very empathetic individual. And she helped me very much so in my sort of transition all the way through some of the issues that I was trying to resolve and deal with. But understand that when I left the military in 98, I wasn't feeling that well, and I didn't know what it was. And I had been constantly seeking medical attention for what I thought was sort of flu-like symptoms of the shakes, fevers, and just not feeling well. And it took me a long time to realize basically what I was suffering from, but it only happened through a discussion that we had at the Legion one time when we were talking about PTSD and everything else, because in those days in 98, it was not a topical issue as it is today, and it wasn't accepted as it is today. So that transition process, leaving the military and not fully understand what's wrong with you, and then moving into a whole different world that is kind of foreign for somebody who's been in the military all his life, is a very difficult sort of transition to make. I was lucky. My wife is an ex-military individual as well, and she helped me through that transition process. But it was a bit of a haul.
Yeah, and it sounds, as we've talked about in one of the past podcasts, is coming from a directive culture and the military mindset of always being looked after, and then now you're out into the civilian side. And then the challenges too, of course, are finding family doctors. And maybe Dr. Sud, you could kind of talk to us about that. A civilian has a challenge finding a doctor, but now we have a veteran who's coming out of a very directive culture, is put out, in a sense, out of the forces and has to find medical care. What are those challenges both for the family doctor who has to treat a veteran and also for, we've heard some from Brad from a veteran's point of view, but what about from a doctor's point of view?
First off, Brad, thanks for sharing. And I am looking forward to hearing more about your story and your experiences and those of your colleagues. I think it's important to take a step back and think about why we're talking about primary care in this context. Canada has a pretty unique, not totally unique, but somewhat unique healthcare system compared to other jurisdictions. Obviously, we have our neighbors to the south that have a very different kind of approach to care. And in Canada, there's a very strong emphasis on primary care, which has been led traditionally by family physicians, but other healthcare providers such as nurse practitioners, pharmacists, physiotherapists, occupational therapists are an important part of primary care. And we know, and decades of research has demonstrated this, that a high-performing healthcare system is very much dependent on a high-performing primary care component to the healthcare system. And here primary care plays a gatekeeping role within the healthcare system. You cannot access the rest of the formal healthcare system, whether that's psychiatric care, inpatient care, specialist care, without access to primary, or it's not impossible, but it's very, very difficult. And we know that the quality of care that people receive who don't have access to continuing care through primary care is not as good as those who have access to a family physician or other primary care provider who knows them well, often knows them. We're called family physicians because we care for families, we care for communities. And so knowing that context is very important. The social context that people are coming to us with is very important. And I think, reflecting on what Brad has said, having an understanding the context of care that people have received in the military prior, of military culture, is extraordinarily important to family physicians understanding how to best care for veterans and veteran families, military families. As you said, access to primary care waxes and wanes. We are definitely in a waning period right now, in part due to the pandemic, in part due to demographic factors. I learned recently that I think in the next 10 years or so, we expect some major percentage, 20 or 30% of our healthcare workforce, particularly the primary care workforce, is sort of on the verge of retirement. And we see then, these reactive policies of, probably shouldn't swear on the podcast, but, oh, shoot, we've underinvested in training in primary care, underinvested in training in healthcare providers. But it takes, to go from, end to beginning, it can be anywhere from, 8 to 12 years once you make the investment to get somebody into practice. So, there's a lot of factors at play, and then you add the complexity of that having been in a military culture, having had access to a different healthcare system, and then potentially, and in some ways this is unique to military people, but in some ways not, because there are a lot of places in the healthcare system where there are transitions. And we know transitions can be very delicate moments in the health trajectory. So even going from inpatient care in hospital back to outpatient care is an important transition in the healthcare system. And if there are not good handoffs, this is not good continuity of care, it's very easy and very common, unfortunately, for health issues to get lost.
So for what I'm hearing you say, Dr. Sud, is, if somebody, we know that veterans suffer with chronic pain at a higher rate than the civilian population. But in order for a veteran to get to see a specialist, they first have to go through primary care, through a family doctor. That's correct. So then Brad, if we're looking at that and we tie, of course, veterans care to benefits, what are some of the barriers? You were at the Legion. The Legion does quite a bit of work for helping veterans with their disability claims. What are some of the challenges that are faced if a person can't get into primary care for, getting their forms filled out? Or is there other doctors, like does Veterans Affairs still have doctors that will help the vets out to get that?
They really don't, Tom. And that's part of the issue. If you don't have the primary care, like Dr. Sud says, to get into the system, then it's extremely difficult for that individual to start seeking the benefits that they need. At the Legion, we basically had service officers who were helping people. When I left the military, I obtained all my medical records. And, the big package of medical records that they ship to you at the end of the day, now it's all electronic, which makes things a lot easier. But if you don't have that package, there's more delays in the system as you start to process through the system. But you've got to get a doctor who's going to who will accept and look at the VAC forms, because they're rather complex. When you had an application form that was about 18 pages initially to begin with, just to get into the system, you've got to have a doctor who's willing to actually look at that and sit down with the individual and say, okay, let's go through this. Let's go through your file. Let's figure out what are some of the issues that you can start to resolve with VAC. But if you don't have that kind of a doctor that's going to look at you and do that with you and have the patience to do it, because a lot of it is very foreign to the civilian world of some of the medical things that we did in the military. So they've got to translate what they're seeing in the medical records from the military back into what they can see and apply onto Veterans Affairs forms. And if you don't have that type of an individual, it could be a very difficult process. Again, you need to find a doctor that's willing to sit, listen, and basically do a bit of investigation as well into what your conditions are and how you can get them through. But I found, as you mentioned with the Legion, that our service officers were basically first rate, well trained, and they could help navigate the system. But they also have to have the medical records, and they also have the doctors fill out those forms before they can ship all that material into Veterans Affairs for the individual to seek benefits. So it's a arduous process, I would say, and it's not just you apply and you get, because then VAC is going to look at that whole process and they'll make the assessment about what your benefit will be. So it's a long process, it's a long road, and the delays that are happening now, I've waited in one of my cases at least 2 years before it was actually adjudicated to be able to come back from VAC to say you have a benefit or not. So that delay system that's in there right now is horrendous. And, we've seen it. Dr. Sud, you talked about the demographic shift to the demographic bubble. I mean, the baby boom bubble has been coming in and people have recognized it for years, but we haven't really addressed, as in the medical system, how do we overcome that? And we're seeing it in the workforce today here, particularly down here. Lots of jobs open for people, but no people to fill the jobs anymore because the baby boomers have said 2 years of pandemic, I'm done.
Yeah. And I think everybody's kind of in that pinch too. And for the listening audience that doesn't know, in order for a veteran who's injured and it's service related, it has to be proven it's related to service. For them to get the medical care covered, they need to have that claim adjudicated and approved or denied, one or the other, which is other processes. But Dr. Sud, I mean, if it sounds from what you're saying that and we're hearing it on the news, is that family doctors and in primary care, I guess, in general, the timelines are tight. So what do you think a veteran can do to better prepare himself, him or herself, when they're going to go in front of a doctor with their claim form in hand, ready to try to get it done and move forward in the process?
Yeah, Tom, that's a great question, which I'm loath to answer, and I'll tell you why. Brad, what you were saying earlier, you're talking about getting your file together, and I mean that's a huge benefit, and it just made me think back to when I was starting my family practice, and I would love. People are going to think I'm crazy, but I would love getting those big folders, because you get the story. Even sometimes before you meet the patient, they're coming into your practice, you get to look through all the investigations, and it's an opportunity for like fresh eyes, and, a fresh look at things that, sometimes things get overlooked, and not because of incompetence, not because of, poor practice, but just, having the benefit of, what's been done in the past. Sometimes patterns emerge that in the moment you're not able to identify. So I loved getting those huge packages, either as PDFs or, slammed down on my desk. But you need the luxury of time to be able to do that. And that is not a luxury that we have, really in any aspect of life, but particularly in the medical system as it is right now. Family physicians and healthcare providers across the health system are very much taxed. And what that does, and this is why I was sort of loath to answer your question, Tom, is it does put more of a burden on individual patients to sort of be prepared and sort of be better prepared, because as healthcare professionals, it's our job to do this work. Don't necessarily because we have these competing demands of providing the best quality care that we can to individuals, but then, we are also responsible to our entire practice, right? And so we need to be able to be responsive to both. And it's a constant source of tension and frustration, both for physicians and patients. So, certainly, I don't want to have to ask individuals to take on these extra roles that they're not necessarily trained to do. But doing things like having your medical records prepared, having reviewed the forms so that we know what's, the kinds of questions or kinds of things that the physicians are going to be looking for. And really, what our role is, for example, organizations like the Chronic Pain Center of Excellence are to, provide the education, the resources for healthcare providers so that they can be better prepared to care for, the unique aspects of being a veteran, including, insurance, right, through VAC and coverage. I mean, there are some benefits, obviously, the package of benefits that are potentially available to veterans means access to services that many Canadians may not otherwise have, which is great, but it can be a bureaucratic struggle. And we see this in other areas as well with other insurers, such as workplace-based insurance as well. So it's not something that family physicians are not used to, but we're not necessarily equipped in terms of time and the specifics of the needs for veterans to be able to do that. So we have a lot of work to do that way.
Yeah, and you can, just listening to the two of you, you can see both sides of the fence. And then you got, a veteran who's coming out of a directive culture that, now is being asked to start fending for themselves. I mean, they have. And then, of course, I like the idea of having, the doctor have the opportunity to look at the file, because we know with our culture that we're numb to pain, and so they may not fully disclose or tell the whole story, which then makes it harder to get it adjudicated in the other end. So there's a lot to unpack here. And, I'm finding that with all our podcasts is that, we're just scraping the surface of this conversation go on for a long time, and we do have to cut this one short. So, I think maybe we'll just have to get together and have another one, another podcast. But I'd like to thank both of you for being on the show. Brad, for your insight and your story, powerful story. And so thanks, Brad, for being on the show.
Thanks, Tom. My pleasure.
And Dr. Sud, for your insight on primary care. I know we hear about it on the news, but to hear it from someone who's actually in it and researched it, it's brings a lot more to light. So thank you for being on the show.
Thank you, Tom. Thank you, Brad.
Thanks, Dr. Sud. Nice to meet you.
Likewise.
We'll just close it off here. And for our listeners, if they have any feedback about the show or want more information on chronic pain, you can visit our website, veterans@chronicpain.ca, or follow us on Facebook and Twitter at chronicpaincoe, or Instagram chronicpain_COE. So we talked about an offer at the start of the program. And for people who are familiar, Dr. Peter Attia, who has a podcast on wellness and health, and I've been following him for some time, and I find that his information has been very helpful. So they've offered for veterans and for our listeners that the first 10 people will have a free subscription to his site, where you'll find a lot of information on health and wellness. And I think a lot of that will help our veteran population. So if you're interested in that, just send an email to the Chronic Pain Center, so chronicpain.ca, or message us on Facebook and Twitter at the Chronic Pain COE, or on Instagram at chronicpain_COE. So I'd like to thank our guests again for attending the program, and for our audience, stay well. Thank you.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network and Eye Contact Productions.